Hey, Dr. Branda here. We need to talk. I've had a slew of patients coming in that think that having 1 to 2 bowel movements a week is okay. They just think that's how their bodies are. And, if you don't know, you don't know. But I'm here to tell you, you want to be moving your bowels at least 1 time per day. At least 1 time per day. I understand that in indigenous cultures and people who live closer to the land, they eat and poo and eat and poo and eat and poo, which seems like the healthiest way to go about doing it. But for now, just aim for at least 1 time per day. If you're not moving your bowels at least 1 time per day, get some help. And I'm not talking about X-Lax. Like, really, call somebody and get some help. There's a problem. And here's the thing, if you're not moving your bowels, you're not releasing toxins. Your body is constantly processing everything from your environment to the food you eat to the things that just by living, it creates its own toxins and it needs to release them, and you need to get that out. So, if you're not releasing them, what do you think happens to those toxins? They sit in there, maybe, but it could be that they just get back and recirculate into the bloodstream. And if you've got toxins recirculating back into your bloodstream, guess what? Headaches, irritability, discomfort, pain in your body, joint pain, maybe can't sleep, depression. I mean, there's a whole slew of things that I could say probably that would lead to, and you don't want any of them. So, yeah, make sure you're moving, get yourself moving, and, taking some Axlax, it's a toxin itself. So, obviously I'm not saying get yourself moving with X-Lax, or smooth move tea is a good way to kind of get moving if you've had some constipation, but ultimately you want to get down to the root cause of why you have the constipation. So if you need some help with that, definitely give me a call or call somebody. I specialize in gut restoration, so I love guts, and I talk poo, so that is part of our conversation every single time. As a matter of fact, I just got a report back from a patient who had her bowels would just release diarrhea spontaneously, and this would mostly happen at night. Thank goodness, kind of, but it was pretty embarrassing for her and certainly didn't do anything for her sex life. And we finally got that stopped. So it's been 2 weeks since she's had a diarrhea impulse at night. So yes, I'm thrilled with that. But there's a reason that was happening. So the idea is getting down to the root cause, figuring out what the cause is, correcting the cause, then you don't have to deal with it and your body can function at its best. So Dr. Brandy McCann's looking forward to sharing with you some more when it comes.